So the pain that you get from sciatica has to be one of the worst that I would say of all of the injuries that we see, particularly with back pain. Sciatica is one of those injuries which just causes horrific, excruciating pain, not just in the back, but predominantly in your leg as well. And if you're experiencing that right now, you'll know only too well what I'm talking about with the pain that travels down your leg. So let's take a look at back pain, and more specifically, we'll look at sciatica. And what we'll do is we'll look at what sciatica exactly it is, why is it a problem to you, and we'll also look at how physiotherapy can help you as well. Before we do, I'll just give you an introduction to myself. My name is Paul Gough. I'm one of the UK's leading physios. That's me there, and also in my previous career working with Darlington and Middlesbrough football clubs, and more recently in America with Manchester United footballer Paul Scholes. So back pain is a thing that we see a lot of here in physio, and I would say easily 6 or 7 out of 10 of the injuries that we see are from back-related problems. And if you ask me to put together a list of the top 5 injuries that we see, sciatica would definitely be on it. And one of the things that you need to look out for with sciatica, aside from the pain, obviously you're suffering from that pain that's happening at your back, and also likely to be in one of your legs as far down as your calf and even your foot. This can easily cause dangerous posture changes and nerve damage, and that's the real problem with sciatica. Is as people put up with this for so long, you're probably experiencing this already. Your posture changes, and what that means is you lean off to one side, or you might even lean forwards in an attempt to relieve the pain. And that's kind of cool in the short term, because it means that you're trying to avoid the pain. But unfortunately, what happens is you pick up a really bad habit, and in the end, if you're not careful, months and even a year sort of down the line, that posture is now completely fixed and stuck. So you're leaning off to one side, or even worse, one of the nerves is completely trapped, in which case you end up with pins and needles, numbness, the leg doesn't move because the nerve is trapped. So sciatica can be a dangerous problem in the long run. And if you have a quick look on the image on the left, that is your sciatic nerve. So basically it runs from your back and it runs all the way down to your toes. And it's the reason that some people come in for physio and tell us they have a bad foot, or they've got a pain in their foot. Nothing at all in their back, but it's an horrific pain in the foot or the calf. And that's because that sciatic nerve travels as far down as that. So how would you know if you had it? Well, you're likely to be aged between 40 and 60. It's a classic age group for somebody with sciatica. Pain is nearly always worse when you're sitting, and you've got pain which goes below your knee, and the pins and needles and the numbness usually happen below your knee as well. If the pain is just in your buttock region or even in your hamstring, that is not true sciatica. That is a disc bulge or a disc prolapse or something else, even a lock sacroiliac joint. If you have true sciatica, it will go right down towards your calf and even into your toes. And one of the other things that people do with when they're suffering with sciatica is they tend to go to bed at night and they will curl up into the fetal position, and it just generally makes the pain a little bit easier. But the pain the next morning is horrific when you get out of bed. So try and avoid that. As much as it does feel comfortable, it's so much easier and better in the long run if you can just lie flat and lie straight in bed. So what exactly is sciatica? It basically means that the fluid in one of your discs is popped to the side. If you reach around to the back of your back and you touch the bones that run up the middle of your back, in between each one of them is a disc. Now those discs are full of fluid, kind of like a jam donut, which I'll explain in a minute. And if you put too much pressure on one of those discs, the fluid squirts to the other side, and that can touch the sciatic nerve. And that causes the joints to lock and the muscles to tighten, which is part of the problem that you're feeling right now, and one of the things that we can help you with. One of the questions we do get asked with sciatica is, what's the difference between sciatica and a disc bulge? Some people go to see their GP and they get told that they've got a disc prolapse, a herniated disc, a slip disc, a trapped nerve. Sciatica, what's the difference? Well, as I mentioned earlier, if you have a quick look on the image on the left, that is a disc prolapse or disc herniation. Now what's happening there is that's touching a nerve, but that's unlikely to travel. That pain is unlikely to get below the knee. With sciatica, it touches one of those yellow things, that's the nerve that comes out and it goes right the way down your leg. So this disc prolapse or this herniated disc is happening in sciatica, but it's touching the sciatic nerve, which is quite low down in the back, and that eventually travels all the way down the leg, and that's the difference between sciatica. If you had a disc bulge, the pain wouldn't go anywhere past your knee. If you have sciatica, it goes right down towards your calf and towards your foot. The best way I can get you to think of it, think of a jam donut. If you were to squash a jam donut, the jam inside would squirt to one side. If you put all your pressure on the left, the jam invariably will go to the right. Think of biting into that lovely jam donut. Invariably the jam will squirt all of your hands at the other side. And that's kind of what happens with a nerve that touches, a disc which touches the nerve. So that's how sciatica happens. Why do you get your pain and restriction? Well, the fluid touches the nerve. That's the first thing. Obviously, any nerve is super sensitive. The disc also has its own nerves. So as this fluid increases and the pressure increases in the disc, those nerves inside the disc are actually being stretched as well. So that's another reason for your pain. And you also get the muscles which tighten and the joints which lock. So you're probably experiencing now a muscle spasm or tension every time that you move or you twist. These muscles are tightening and these joints have locked to help protect you so that you don't damage this disc even further. So how can physio help? Well, you definitely need hands-on treatment with sciatica. We do things like mobilization, manipulation, lots of massage for that muscle, try and get the joints moving, and ultimately we try to open up the disc space. You can't do anything for the disc. We just open it up and we just let the fluid inside the disc seep back in by taking the pressure off it. We'll give you a full explanation of what it is, specific to you, how it happened, and we'll look for ways to stop it from happening to you again. So if this has happened because you spend a lot of time sitting or leaning forwards, we look at exercises specifically to make your back stronger to allow you to do that. As I said, exercises to do at home, which you can also get on this website. If you have a look after this video, just below where you're watching it right now will be a section where you can just simply put your name and address in, name and email address, and you can get exercises to help strengthen your back up, which will get you on that road to recovery from sciatica pretty quickly. Visit us for help ASAP. Physio will definitely help you with this injury. It'll take us 4 to 6 weeks minimum. You'll need 4 to 6 treatment sessions, and we'll do things like deep massage, stretches, and exercises. All of which will benefit you quite quickly. And what you usually find with sciatica, the first session irritates it a little bit, and after that you normally find a 10, 15, 20% recovery after each session. So over a period of 4, 5, 6 weeks, it just gets that 20% better every time, which towards the end of 3 or 4 weeks you start to see a huge significant difference. And it takes about 6 sessions to really make a person safe, and what that means is so that this sciatica pain doesn't come back or is less likely to come back. So where are we? We're in Darlington, Durham Guisborough and Hartlepool. That's a picture of inside one of our clinics. What we always offer is get your session free if physio can't help. So if we can't do any hands-on treatment, we can't give you exercises, and we can't even give you a diagnosis to send you on to see a specialist or somebody else who can help you, you'll never have to pay for your treatment with us. And to book your physio session, you just need to call 0800 043 8671. That number gets you through to us. And just before I finish, I'll just show you 1 or 2 pictures inside of our clinic and the staff that's inside of our Guisborough clinic. Pretty much any member of staff that you come across here are all really active. They're all very friendly, outgoing, fun people. That's a picture inside. It's an in-house yoga class that we do every Wednesday morning. And that's a picture from inside of our Hartlepool practice. So if you're coming to see us, we look forward to it. 0800 043 8671 is the number you need. And just to confirm, if you have sciatica or you're suffering from it, A, get the exercises on this website, this page that you're looking at right now, but B, we can definitely help you with hands-on treatment. That's it from me. Thanks for watching, take care, and we'll see you soon.